Let's continue this discussion now. We're talking vaccinations, and it's interesting that South Africans are apparently losing confidence in vaccines. This according to a global survey conducted by the UK-based Wellcome Trust last year. I'm joined now by Dr Malcolm Kendrick, who's an author, speaker and a skeptic. Thank you very much, Dr Kendrick, for your time. Speaking out against vaccines is a taboo, and especially for a medical professional, that's very unusual and quite challenging. In fact, you've written that speaking against vaccines is a reputation shredder, and yet you do tackle the subject head on. So what are your fears and concerns around vaccinations?
Well, just addressing your first point, obviously if you have any concerns or any fears about any vaccine, you're called an anti-vaxxer. If you have any questions about vaccines, you're an anti-vaxxer. So it's, this is Richard Feynman, who's a Nobel Prize-winning physicist, a very famous quote. He said, I'd rather have questions that can't be answered than answers that can't be questioned. And I think all I'm trying to do, and there's a number of other researchers are trying to do, is just ask questions. We're trying to ask fundamental questions. A fundamental question would be, the main organization probably in the world is the Center for Disease Control in America. And they were recently asked if they had any evidence of looking at the health of vaccinated versus unvaccinated populations. Have they ever done such a study, which you would think would be an entirely fundamental piece of work to do? And they resisted answering this question for a while. About a month ago, they finally revealed that they have never carried out a safety or efficacy review of vaccines in the vaccinated and unvaccinated population. Now, this is the kind of thing that gives me, as a doctor, a concern. Well, why haven't you done such a basic, fundamental piece of research? Why has this never been carried out? It's never been carried out. Why do we never get these reviews? So, I'm not saying that vaccines aren't safe. Vaccines are pretty safe. Very safe. Most people, the vast majority of people, have no problems. But if you want to find out if there are people who can get problems with vaccines, who are they? Can we identify them? Can we identify them and prevent them from being damaged by vaccination if there is vaccination? Now, some people are damaged by vaccination. The last pandemic was the swine flu H1N1, as you may recall, and they rushed out a vaccination here. And there are lawsuits going on around Europe, Sweden and Ireland, because a number of children have been found to have developed narcolepsy following vaccination. Now, these are facts, and the facts have been admitted by the vaccine manufacturers. So vaccines can cause damage. They can do this, and we need to make sure that we cause as little damage as we possibly can. And yet, unfortunately, it's incredibly difficult to even address these issues. So you're basically told all vaccines are safe, every vaccine is safe, no vaccine has an adverse effect. Oh, by the way, we've never actually studied this. So I think you can possibly understand why some people are concerned by this lack of evidence and the lack of attempt by the authorities to find out very fundamental things.
So I understand that while you're saying that you're not against vaccines in any form, but you are for making them as safe as possible, then we're talking also about the issue of making vaccines mandatory or compulsory. And I think one of the issues that we need to address is different context. In a context where you have high levels of poverty, substandard levels of education, high levels of teenage pregnancy, a general lack of access to quality, affordable public medical health care, the issue becomes a lot more complex, and perhaps authorities are choosing the easy route by saying, okay, well then the easiest way is to not let people make up their own minds. What would be an alternative?
Well, I think if you go down that route, that's a very dangerous place indeed. The Nuremberg Convention after the Second World War made it very clear that no person should ever be forced to take a medication against their will. No person should be forced. There should never be mandatory medication of anyone. Now, if you want to breach that principle, the Nuremberg principle, the courts And everybody tiptoes around this very, very carefully. So we're not making it mandatory, but if you don't have a vaccine, you can't leave your house, you can't travel, you can't have a job. I mean, to an extent, enforced medication is also essentially something the Nuremberg Convention goes against. Now, you either believe that that's a very fundamental human right, that we can't be forced to have things we don't want to, and I support that entirely. And it's also an admission, to an extent, of defeat. If you think that your medication, your vaccination is so absolutely wonderful, then there should be no problem with doing this. I mean, another problem, of course, is the people that are most at risk from vaccination are the elderly, who are also very most at risk from COVID. The elderly with multi-morbidities. The elderly with multi-morbidities don't respond terribly well to vaccination. Vaccination gets less effective as people get older. The younger population, the children, in the United Kingdom, last time I looked, under the age of 20, 14 children, or well, they're not really children, under 20, 14 people under 20 had died from COVID, and 10 of those had underlying medical conditions. So we're talking about vaccinating millions and millions and millions of people against the disease that is vanishingly unlikely to have any severe impact on them. So you have to be very, very careful. This is a very skewed disease, COVID. Really, the average age of death in the UK is 81. The last time I looked, it's over 80 in many populations. And these people are all ill. The CDC in America came back and said that they found that only 6% of people who died of COVID did not have serious underlying medical conditions. So I think also we're talking about vaccinating an entire population to protect a very small group of people. Again, you have to be very careful with doing this. And so I would never mandate and would never support mandating and mandatory vaccination. I think this is a very difficult and slippery slope, a difficult place to get to.
Have you done any research or spoken out against or relating to the politics of vaccines? We also see vaccines developed and access to those vaccines are controlled by large pharmaceutical groups. There is, of course, the financial, political element that comes into play. Distribution to certain places doesn't quite happen as quickly as in others, depending on the relationships between countries and where those vaccines have developed. What do you think the impact could be on African countries specifically when a vaccine is developed for COVID-19?
Well, we all know that, I think the UK has already done a deal to stockpile 300 million vaccines, which is about 5 times the entire population of the United Kingdom. So when vaccines, if they become effective and are available, we all know that there's a financial imperative here. And essentially, the countries who've got the money to pay will be the ones who get the vaccines. There's no doubt about that. We know that the poorer countries will be at the back of this queue. I don't think anyone is going to question this. This is bonanza time for pharmaceutical companies. If they're going to almost charge what they like, what are they going to charge? I don't know, 20, 30 pounds sterling. Not sure how that converts to rands. For potentially 7 billion people. This is 200 billion pounds of, not all profit obviously, but there's an enormous financial incentive to push and press for this to happen. And of course, that's mainly going to happen. It's going to start happening in the countries that have no problem with paying for it. And whether or not they're going to actually say, oh, yes, all these other countries can have it for free, or say, well, we'll kind of believe that when we see it, frankly.
Let's have a look quickly at alternatives to vaccination, not just focusing on COVID-19, but vaccinations in general. Wealthier countries have better healthcare systems, better public healthcare systems, better access to quality nutritional food, healthy lifestyle. Poorer countries don't have that. So when we're looking at alternatives to vaccines, they might not be as viable in poorer countries. What do we do about that?
Well, sort out world poverty. That's my next job. What do you do about that? Very difficult. But I mean, one of the things that I've banged on about since the start of this is to say, why is influenza seasonal? Why does it come in countries in the northern hemisphere in their winter, and the southern hemisphere in their winter? And I think one of the major issues, a lot of people are very, very supportive of the idea that it's probably due to vitamin D. And I think this is especially an issue for dark-skinned people. You know, I have pale male and stale skin in the northern hemisphere, because when people's moved from the equator to further towards the poles and the sunlight fell, the amount of vitamin D you could synthesize in your skin went down. So our skin went white, as if we are a poor adaptation. And increasingly people are being told to stay out of the sun, and this is even occurring in countries in South America. Even people who you would think in sunny countries are getting low vitamin D, partly because they're terrified of the sun. So really, one of the things everybody can do, and it's not that expensive, is to take significant vitamin D supplementation, as this improves the resistance to infection. This has been proved time and time and time again. So when you look at in the UK, but especially and in the Northern Hemisphere, what they call BAME, the Black, Asian, minority ethnic groups, are far more likely to die from COVID. And these groups are also far more likely to have low levels of vitamin D, because their skin does not synthesize vitamin D so effectively, especially when they get further from the equator. So here's one thing that everybody could do. As for the other things, I mean, this is a huge problem. There's also an association with diabetes, and unfortunately, this is a real problem, again, more for the BAME communities, because they're eating high carbohydrate foods, they're becoming obese, they're becoming diabetic, and this vastly increases your risk. So, I mean, where's the answer? Well, the answer is go back and eat the stuff you used to eat, 1,000 years ago. That's very, very difficult. I understand that. But it's very difficult to sort this out over the next year or two.
All right, thank you very much for your insights. Dr Malcolm Kendrick speaking to us there from Manchester in the UK. We will continue our health focus this morning on vaccinations after this. Do stay with us.